I've had a lot of men that message me that they follow the keto, the carnivore diet, and that cholesterol doesn't matter. And that when I've posted things about reducing sodium amount, that salt is necessary, that it's not bad to have more salt in your diet. There's a lot of disinformation out there and a lot of health influencers that people I know follow that have hundreds of thousands of followers. So they think, well, they must know what they're talking about because of your credentials and everything that you've studied. A, does cholesterol matter? And B, high salt intake. Does that matter?
Yeah. So these questions come up with me also with people I'm working with students, with people on the internet. And okay, so let's tackle one at a time. So the cholesterol. The cholesterol in the blood and the cholesterol level was considered a huge problem for many years. And then it was 2015 when the US dietary guidelines took cholesterol off as a concern. So there, the feeling was that your level of cholesterol in your blood was not, in fact, the major problem. So what you were consuming was not necessarily going to impact what type of atherosclerotic plaques you developed. That it was more complicated than that, and indeed it is. It is complicated. It has a lot to do with inflammation, and we learn more and more as time goes by. Now, with that said, the American Heart Association still recommends that people who have heart disease and are concerned about heart disease monitor cholesterol. We've learned more and more about this. It's not just total cholesterol. We want to know the LDL cholesterol, we want to know the HDL cholesterol, we want to know the ratios, and even more so now, it's apolipoprotein B. So there's also lipoprotein little a to look at. So looking at lipoprotein B, we're talking about looking at the cholesterol factors in the blood, because LDL is cholesterol, HDL is cholesterol. There's different types of cholesterol in the blood. So looking at the type of cholesterol that has been associated with atherosclerotic plaque is where the science is right now. So total cholesterol doesn't give you the full picture. If you're just looking at total cholesterol and just looking at articles that looked at total cholesterol, you're not looking at the details carefully enough. You need to be looking at LDL, LDL particle size. You need to be looking at your LP little a and where you are with your LP little a. You need to go deeper into detail with cholesterol. Now, mind you, you heard my history, and eggs obviously are high in cholesterol, and they were very much a concern for years. And then again, 2015, don't worry about it. Turns out, so I decided to do my own experiment with myself. And everybody has to do this too. You know, this is personalized medicine. We don't
Yeah.
understand everything. You can get generalizations, but you don't exactly understand how my body, your body will respond. So I decided I'm going to check. So I went back on eggs after not having eggs for years and years. Went back on eggs, and sure enough, yes, my cholesterol did go up in response to eggs. Is that yours? Is that going to be for you, a listener here? I don't know.
Yeah.
You're going to have to, if you want to test this, then you need to work with your primary care provider and get the pre and post tests. So cholesterol and inflammation are still something to be considered. It's not just necessarily your total cholesterol. You've got to look at the LDL, you got to look at
Yeah.
the HDL, the particle size, and get deeper into the lipoprotein B and understanding the cholesterol. That's the first thing. Second thing with the salt. So salt is everywhere. We consume salt in pretty much everything we eat, unless you're eating from the ground. Every single thing, everything is from the ground. Otherwise, what you drink, unless you're only drinking water, you're not having almond milk, you're not having any other beverage, just water. If you're just having vegetable from your ground and just water, then maybe you're going to have low salt. But I know no one in this situation. If you even have a slice of whole grain, whole wheat bread, it's got some salt in it. If you look at any ingredient package, not even the ultra processed packages, but food that we consume on a regular basis that's considered healthy, there's
Yeah.
going to be some salt in it. So yes, salt is important for life. They're right. You're right. Yes, it's true. We need salt to live. That's very true. But the guidelines are to limit it, especially if you have high blood pressure. 1,500. Most of us are getting 3,000 or more milligrams
Yeah.
of sodium. That's too much, and that's connected with high blood pressure. So limiting it, especially if you have high blood pressure, is essential. The data
Yeah.
is out and strong on that. So
Yeah.
yes, we need salt to live. People like to use that argument all the time. You need salt to survive. And this is true. You need salt to survive. We have plenty of salt.
We're eating way too much of it.
We're eating way too much of it. There's no reason to be putting salt on your food in the
Yeah.
United States.
Yeah. And I don't think people realize that when you go out to eat, you're having way too much of it when you eat out or when you're eating processed, ultra processed foods.
Oh,
You have to read labels.
absolutely. And it is a nutrient of concern. So we want to lower our salt intake as a nation. We know this.
Yeah.
So is
Yeah.
saturated fat.
Yeah.
So for the carnivores, I'm just mentioning, right, there's saturated fat, and you have to realize the saturated fat can increase the cholesterol and the cholesterol that is not healthy for us. The LDL,
Putting you at greater risk for
heart disease, and stroke are number one.